Well, this is a great pleasure for me today because I love to have doctors who I call cutting edge physicians, people who are doing things that are not usual. And the only time you want to see them is when you really need them, and then you want to see the best. And so Dr. Davis comes with very high credentials. Welcome to our show, Dr. Davis.
Thank you for having me.
It's a pleasure. Dr. Brandon Davis, he's with Memorial Healthcare Systems, which have such a great reputation. And why don't you tell people what your specialty is, because it's unusual.
All right, so I'm a neurosurgeon. I'm also a neuro-endovascular surgeon as well. And so I focus primarily on diseases of the brain tumors, and also cerebrovascular diseases, diseases of the blood vessels within the brain. So things like aneurysms, things like strokes. And some of these blood vessel diseases I'm able to treat surgically by doing a surgery on the brain itself. And then other times we have advanced technology that allows us to treat some of these diseases without actually cutting into the head itself through a minimally invasive technique by going within the artery. We access the artery in the leg, and then we take tiny instruments up to the blood vessels in the neck, then to the head, and we're able to repair aneurysms. We're able to remove a blood clot that could be causing a stroke. And so that's a large part of my specialty, a large part of the surgeries that I do here. I also do brain tumors that can be deep within the brain. Sometimes I can use minimally invasive or endoscopic techniques to go through the nose to remove tumors. Other times tumors can be in a very sensitive location of the brain, perhaps the language area of the brain. And in order to not disturb that, sometimes we even have to map out those language areas because they can be different for each individual. Not everybody kind of follows the textbook. And so we use specialized imaging to map those areas out. And even sometimes we'll have to wake a patient up during surgery to monitor their language and interact with them and making sure that they're going to wake up okay. And we can remove those tumors from those very sensitive areas that way. And those are my specialties here. I work with a great team. We have a number of neurosurgeons in our office that offer everything from epilepsy surgeries to spine surgeries, surgeries for the nervous system like carpal tunnel release. And so we all work together to provide a diversity of care for the neurological system.
Well, Dr. Brandon Davis, that was great. I'm just gonna let you keep talking. I mean, you're really quite articulate. And as you were speaking, I was thinking that for so many years, the brain has not really been the big thing. It's been cancer, the heart, it's been other things. And now the brain they realize that the brain holds the power to everything, doesn't it?
Absolutely. You know, it's sort of the window through which we experience our lives here. And we've learned over the years that there are things that can be affecting the brain that can be very easy for us to detect. You know, for instance, if somebody has a stroke and they have weakness on one side of the body, but there can also be more subtle things. Sometimes it can be a headache or even a personality change that can be a process going on in the brain that we can correct if we can identify it and treat it in a timely fashion. And so I think one of the things that's helped us treat patients and understand a bit more how the brain works and how disorders can arise is our imaging capabilities, which have advanced pretty well in recent years. Our capability to do very detailed MRI scanning of the brain as well. And, you know, MRIs are becoming more and more prevalent at different centers throughout the country. And so, you know, I think that allows us to identify these problems, treat these problems, and then even afterwards, we continue to monitor sometimes to make sure the patient is recovering well they're not having any kind of recurrence, and that the brain is healing properly. So a lot of these technologies are giving us more insight into how the brain works, and also allowing us to better treat the patient as well.
Well, I know very little about the scientists of the brain. We all know who first did who did the first heart transplant, but are there some famous people you can talk about that really discovered what you're talking about in the brain?
So, surgeries occurring through the cranium are actually quite ancient. There have been manuscripts found even from ancient Egypt that show people drilling holes in the skull to sort of release what they call spirits and things like that. And ironically, we even do that today. Sometimes folks can have some blood up under the skull from an injury that we need to release the blood and things like that. More advanced techniques have evolved as we've been able to develop our anesthesia, put a patient to sleep safely, things like that. One of the American fathers of neurosurgery is Harvey Cushing of Johns Hopkins, and he pioneered sort of pushing the boundary in terms of treating some of these diseases. And I think that having that anesthesia available is one of the things that allowed him to do that. As the imaging qualities improved, I think neurosurgery became more prevalent. In the early days of neurosurgery, before we had MRI, oftentimes neurosurgeons had to rely on the physical examination. Essentially, we had to test motor strength, speech, sensation, balance, vision, test all these minute different things. And based on any deficits or problems the patient had, we had to try to localize in our minds where that problem could be in the brain, and then proceed with the surgery based on a physical examination. Now with MRI capabilities, we still do those examinations, but now we have a picture to verify the problem that we're seeing, and that makes the surgical planning and the surgery much safer. There's also a surgeon named Yasser Gill who helped pioneer modern neurosurgery, because he sort of brought to neurosurgery the use of the intraoperative microscope. One of the limitations of early neurosurgery is, some of these problems can involve very small blood vessels, very tiny nerves that are extremely delicate. And sometimes even if you just graze them or touch them, someone can have a neurological problem. They can't open their eye, they can't see, they can have weakness in the face. And so Dr. Yasser Gill brought in the use of the intraoperative microscope. And so that allowed us to zoom in on these very tiny structures. And it also allowed us to sort of zoom in on the movements of our hands and our fingers, and allowed us to create an art in terms of positioning your body, resting your hands, controlling your breathing, and develop over practice these very, very precise, delicate movements of the hands. And so that's what we call microneurosurgery. And I think that's what allows us now to do some of these surgeries in very sensitive areas of the brain. It allows us to clip an aneurysm that could be pushing on a nerve without disturbing sort of the normal brain functions. Even today, there continues to be advancements in terms of intraoperative MRIs, intraoperative monitoring of the brain function, advancements in terms of visualizing while you're operating, tumors and tumor boundaries, so you can kind of tell the difference between some of the normal brain and tumors. Some tumors are very easy to see when you're in the brain, and some of them blend into the normal brain a little bit. And so now we're also developing different dyes and different fluorescent techniques that we can use to sort of see the invisible, so that we can see those abnormal cells, those tumor cells, and hopefully take out the entire tumor without disturbing the normal brain. So it's a continuing and growing field, and that's kind of what makes it exciting. It's still a frontier in medicine. We've come a very, very long way, but there's still miles to go.
Well, your passion certainly comes out. I love it. I love to be quiet like this, to hear someone who's so articulate and so enthusiastic. I was thinking as you were talking that something as mundane as the migraine headache. There are people that suffer from migraine headaches and they've tried everything. And so is this something why is it so difficult to take care of a migraine headache?
Migraine headaches in general can be very challenging. One of the challenges of headaches is there can be many types of different headaches, and then there can be many different reasons as to why an individual can have a headache. There are different theories out for different types of headaches, in particular migraine headaches. Some theories propose there can be some abnormal electrical activity causing a migraine, and there are some theories that it can be from spasming or irritation of the blood vessels themselves within the brain. And then other theories show that there can be some irritation of the covering of the brain. Certainly, we have seen instances of all those different things. We've seen folks have problems, folks have headaches, and we can see evidence sometimes of the blood vessels constricting when we're looking at our imaging. We can see evidence of inflammation of the covering of the brain. And then sometimes when we measure electrical activity, we can see some abnormal electrical activity in patients that have those. I think the thing that makes it difficult in treating things like migraines is that, when it comes to the brain and human anatomy in many respects, people are very much individuals, and people can be very, very different in terms of their brain anatomy. They can be very, very different in terms of how they're affected by some of these things that we think can cause their migraine. And so some folks respond very well to certain types of medicines that we get for migraines, for instance. And then you have some folks that don't respond at all. And so when treating migraines, it's very important to have a neurologist who does treat headaches often. So it's important to have a good neurologist, but I think more importantly, it's important to have a neurologist that you have a good relationship with, because what's a key to treating a migraine or headaches in general is that you have somebody that's listening to you, basically. Because I think that the key to treating those type of disorders is understanding how the patient's feeling, understanding how they're responding to the medicine, understand different things that could be triggering those headaches. And oftentimes it can be a back and forth. These neurologists will have to listen to the patient to understand what's going on and how they're responding to the different things they've tried. And then they use their expertise and knowledge to make a recommendation in terms of maybe trying a different medicine or maybe removing some medicines that could be the culprit, in fact, sometimes, or maybe finding some environmental factors. And then once that neurologist makes those type of recommendations, the important thing is there's going to be some back and forth. Typically, folks don't get it 100%, on the first try. And so it's very important for those type of disorders for there to be a good relationship, a good trust between the physician and the patient, so that, if things aren't working very well for the patient, that patient needs to feel confident that they can communicate that to the physician without feeling like maybe they're disappointing them or something like that. And so there needs to be a little bit of a back and forth interplay to kind of fine tune things to create the best outcome. And so, I think some folks, they go to the neurologist, someone they recommend, and they may not have that connection, and they stay with them for years, and they, kind of get stuck in a little bit. My recommendation typically is, if you guys aren't getting along, if you're really not feeling that connection, I think it's important that, you talk to your primary care physician and say, hey, is there somebody else I can see? for second opinions, even for my own patients. It's all about the patient. So I think, second opinions are sometimes, lead us in a different direction that can be the right direction sometimes.
Dr. Brandon Davis, I have to tell you, you are amazing. I've interviewed so many people and so many doctors, and for a while we were doing a cure symposium where we had doctors, scientists who were really cutting edge. And when we start them up again, you are number one. You are just terrific, and I can see that you're great as a physician, but I think you really have the professorial ability. I'd love to see you teaching some of the young physicians all the things that you're saying, because you're right on. It's lovely to talk with you about this.
Well, thank you.
Well, I guess as a gerontologist, I'm very interested in Alzheimer's. And of course, so many of you are working on that. And do you think we're ever going to figure that out?
I think Alzheimer's is a challenging disease. I think it is the focus of a lot of research over the past decade, over the past 2 decades, as we start to understand a little bit more of the cellular biology and identify things that correlate with the development of Alzheimer's. And I think one of the things that, has come to fruition over the past decade or two is the accumulation of different sort of waste products and things within the neuron itself, within the cell itself. So we're getting a little bit stronger understanding of what is causing the problem or what is contributing to the problem. And I think, the next phase of science will be being able to prevent those things from happening or be able to reverse those conditions within the cell itself. The challenge of treating a lot of diseases, including Alzheimer's, is that sometimes even if we understand some genetic problem or some genetic predisposition, some protein that could be that can be responsible for the disease, the problem can be getting to all those millions of cells and correcting the problem in each one of those cells. I think science has come along well to be able to do this in a laboratory setting, sort of in a petri dish, if you will. But when we try to do it in people, it becomes extremely much more challenging. And I think currently that's one of the barriers to our technology in terms of treating these types of problems is creating medicines that can get to essentially every cell in the body and correct the problem. And particularly the brain, because of the blood-brain barrier, a lot of our therapeutics can get modified or sometimes cannot pass through the blood-brain barrier to get to the target cells themselves. So I think as we develop and predict drugs that can get through the blood-brain barrier, as we develop and create drugs that can fix a large number of the cells that have the problem. Some of the drugs we have now, some of the therapies we have now, fix a smaller, we can detect them in a smaller proportion of the cells. But I think we have to continue to try to create medicines that can treat a larger number of the cells in conjunction with things that are protecting the entire body as well. I think that's sort of the next phase of science. And I think a lot of people are sort of moving towards those things, things like gene editing and things of that nature.
Exactly. But will you explain, and we hear it so often, the blood-brain barrier, and that's really, it's a good thing, isn't it? Because if that weren't there, we
Right.
could explode.
So the brain is very sensitive. Yeah, there's a natural barrier that basically prevents some of the toxins from getting into the brain. The brain is very sensitive to things that can be reactive oxygen species, for instance, free radicals, other toxins that the normal blood can deal with very well. The brain is a very privileged environment, and that privileged environment allows the conduction of those little electrical impulses to be so efficient. The brain has to tightly control the concentration of salts, of ions on both sides of the cellular walls, of both sides of the cables, if you will. And by keeping that sort of tight balance, that allows that electrical impulse to fire at a rapid speed. When those concentrations are off, that causes neurological dysfunction. And so that's one of the reasons why that blood-brain barrier is there has to be a special environment to allow those electrical impulses to fire efficiently. And so the blood-brain barrier is actually actively pumping things out of the brain space. Even metabolic waste products that the brain makes are getting actively pumped out of that area to kind of keep that environment pristine and optimal for the neurological function. And so
I see. Well, thank you. I've never asked that question. I never understood it, but you made that so it has a special environment. Well, I want to make sure everyone understands that this is Dr. Brandon Davis, and he is with the Memorial Healthcare Systems, which is a great system. They have, I think you have 3 or 4 hospitals in Broward, and they each have great physicians. I know many of them, but you're really special, and I am so glad that Narupa found you. We're going to have you back again because you are really beautiful. And if I'm going to put your name and your phone number in my wallet. If I have any problem with my brain, I'm calling for you because you're good. And I am so happy. I know you have a lot to do and you're a busy guy, but this was very special because we're going to put this on Facebook and then YouTube, and you should be very pleased. I want to ask you a question. Well, did your mother always want you to be a doctor? You know, I always ask the doctors about their mothers because their mother plays such an important part. Did she always know that her son wanted to be a doctor?
Yeah, so she definitely nurtured that from a very young age. And my parents tell me that even when I was very, very young, I drew pictures of, the doctors, and back in that day, what was the reflector in the middle of the head when I was in kindergarten. And so whenever anybody asked me what did you want to do when you grow up, it's kind of always wanted to be a physician. And so for as long as I can remember, that's kind of what I've always dreamed of doing. And so, and my parents have definitely strongly supported me in that. And I will always appreciate that.
Right. Well, the other thing, but you did choose a specialty that, why did you go to that? I think we have a little bit of time left. And that took another, 3 or 4 years because you have a PhD as well as an MD.
Absolutely. And so I think it kind of all started from sort of a curiosity of really understanding, human consciousness, kind of what makes us tick a little bit. And then trying to take knowledge and preserve that, and protect that against disease states. And so the reason for the PhD, I actually studied cellular biology with a focus on the blood-brain barrier and neurons and neuroscience, to give me a bit of the understanding of sort of the microscopic aspect of it. And then later on, I went into the sort of macroscopic, a larger aspect of it, looking at the anatomy of the brain itself and understanding how all these little tiny things make up larger structures and how they talk to each other to create language or emotion and things of that nature. And so I've just found it so fascinating, throughout my entire journey. And I'm learning something essentially every day, probably for the past 20 years. And that's another thing that draws me to it strongly. It's a lifelong learning. It's a lifelong practice with every patient that I see. I want to understand something deeper about the mind, deeper about people in general, how to reassure them, how to guide them through, something that may be, a life-changing thing for them, how to take that from a negative life-changing thing and making it perhaps even sometimes a positive life-changing thing, to where they may take the opportunity to sit down and reflect and interact with their family. And so, for me, it's every day learning more about the mind, the neuroanatomy, the science,
And Dr. Davis, I have to tell you, this has been one of the most superb interviews I've had, and I do a lot of them. I've held my breath, but we will have you back again. I thank you so much, and I'm so glad to have met you. And I know that you're going to rise to the top. I just can see it. There's going to be something very big, even bigger in your life that's just going to happen. You are a star, and I don't say this casually. So thank you again, and we'll be talking.
Absolutely.
All right. Goodbye, Dr. Davis.
Thank you.
Thank you.